بسم الله الرحمن الرحيم. My name is BxxfA0bi, Assistant Professor of Chest Diseases, Faculty of Medicine at Ain Shams University. I would like to talk to you about the protection of healthcare workers during the COVID-19 outbreak. During an outbreak, healthcare workers are expected to work long hours under significant pressure with often inadequate resources, while accepting the dangers inherent in close interaction with ill patients. So healthcare workers, like everyone else, are vulnerable both to the disease itself and to the rumors and incorrect information that necessarily increase their anxiety levels. During the outbreak of the SARS in 2003, the healthcare workers' anxiety levels rose in reaction to cases of healthcare workers or colleagues falling ill or dying. As a result, healthcare workers became increasingly reluctant to work. Healthcare workers' anxiety was further impacted by growing stigmatization and loss of trust by their own communities. In short, even as demand for healthcare workers rapidly rises during an outbreak, which is a fact, so too does the healthcare worker anxiety and reluctance to work. Here are some examples of the healthcare work tasks associated with exposure risk levels. For example, the lower risk, which needs only caution, any healthcare worker performing administrative duties in non-public areas of healthcare facilities away from other staff members. The medium risk, when there is a healthcare worker providing care to the general public who are not known or suspected COVID-19 patients, or working at busy staff work areas within a healthcare facility. The high risk occurs when the healthcare worker is entering a known or suspected COVID-19 patient's room or providing care for a known or suspected COVID-19 patient not involving aerosol generating procedures. The very high risk occurs when the healthcare worker is performing aerosol generating procedures, for example, intubation, cough induction procedures, bronchoscopies, some dental procedures and examinations, or invasive specimen collection on known or suspected COVID-19 patients, or collecting or handling specimens from known or suspected COVID-19 patients. There are a number of standard precautions that should any healthcare worker follow during his work with suspected or confirmed COVID-19 patients. First, the hand hygiene with water and soap or alcohol-based solutions, using the personal protective equipment according to the risk, respiratory hygiene or cough etiquette, safe injection practices, sterilization or disinfection of medical devices, and environmental cleaning. When we come to the personal protective equipment for health staff or healthcare workers handling coronavirus patients, the full protective gear given to staff carrying out procedures likely to generate coughing, such as inserting a tube to aid breathing, which is the endotracheal tube, consists of the eye protection with full face visor or goggles, gown fastened behind, hands washed thoroughly before putting on gloves pulled over gown sleeve. The healthcare staff likely to come into contact with coronavirus patients but not carrying out invasive procedures will be given gloves, apron, surgical mask, and possibly goggles. All the equipments are disposable. The Center of Disease Control, or the CDC, differentiates between what is called the preferred PPE gear and the acceptable alternative PPE gear. In both situations, there is isolation gown, one pair of clean non-sterile gloves, face shield or goggles, but the preferred PPE gear should include the N95 face mask or higher respirator, and in the acceptable alternative PPE gear, we can use a face mask. These photos show us different types of masks used nowadays, like the N95, the surgical masks, and the cloth masks. This illustrates the proper structure of the mask that helps in prevention of infection. It consists of 3 layers. There is the high spec filter, which is a superior filtering performance. There is also the pre-filter, reinforce the filtering performance, and a space keeper, which makes a room in front of the mouth and relieve the feeling of dyspnea. There is a nose bridge that fits on the face and prevent particles, and the elastic cords on both sides of the mask to fit gently behind the ears. There is a statement from the WHO, the World Health Organization, about when to use a mask. The WHO states that for healthy people, wear a mask only if you are taking care of a person with suspected or proved COVID-19. Wear a mask if you are coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. If you are wearing a mask, then you must know how to use it and how to dispose it properly. Also, the WHO states that you should replace the mask with a new one as soon as it is damped, and do not reuse single-use masks. To remove the mask, remove it from behind and do not touch the front of the mask that may carry the viral particles. Discard immediately in a closed bin. Clean hands with alcohol-based hand rub or soap and water. Also, the CDC, or the Center of Disease Control, when describing how to use the respirator, stated that the respirator must be put on correctly and worn during the exposure. Then the respirator must fit strongly against the user's face to ensure that there are no gaps between the user's skin and respirator seal. The respirator filter must capture more than 95% of the particles from the air that passes through it. Here are some procedures that are considered as aerosol generating, which are considered to be the most dangerous for any healthcare worker. For example, the intubation, endotracheal intubation and related procedures, manual ventilation or ambo bagging, respiratory and airway suctioning, including the tracheostomy care and sputum induction, nebulization, nasogastric aspiration, or non-invasive mechanical ventilation. Other aerosol generating procedures include the bronchoscopy, cardiopulmonary resuscitation, surgery, sputum induction, suctioning, autopsy for a patient died with COVID-19. All of these procedures, the number of healthcare providers exposed should be limited to limit the spread of infection. How to do the negative pressure user seal check, which is very important to ensure that the mask is fitting on the face. The negative pressure seal checks are typically conducted on particulate respirators that have exhalation valves. In order to conduct the negative pressure user seal check, cover the filter surface with your hands as much as possible and then inhale. The face piece should collapse on your face and you should not feel air passing between your face and the face piece. In the case of either type of seal check, if air leaks around the nose, use both hands to readjust the nose piece by replacing your fingertips at the top of the metal nose clip. Slide your fingertips down both sides of the metal strip to more efficiently mold the nose area to the shape of your nose. Then readjust the straps along the sides of your head until a proper seal is achieved. If you cannot achieve a proper seal due to air leakage, you may need to fit tested for a different respirator model or size. How to fit the precautions according to the type of transmission of infection, which is called the transmission-based precautions. In case of contact precaution, you should wear the clean isolating gown. In case of droplet precaution, it will be enough to wear a surgical mask. But in case of airborne precaution, you should wear N95 mask. How to apply the transmission-based precautions in cases of COVID-19. For any suspected or confirmed case of COVID-19, the precautions should include the standard precautions, washing the hand with alcohol-based solution or water and soap, with the contact precautions with the isolating gown, and the droplet precautions including the surgical masks. But for any suspected or confirmed case of COVID-19 and aerosol generating procedure, the standard precautions should be in hand with contact precautions and airborne precautions and not the droplet precautions, which means wearing the N95 mask. How we tailor the PPE gear according to the level of care for cases of COVID-19. For example, in the triage, it's enough to perform the hand hygiene and to wear medical or surgical mask. In case of collection of specimens for laboratory diagnosis, we should perform the hand hygiene, wear a gown and a respirator like the N95, the goggle for eye protection or face shield for facial protection, and gloves. In case of suspected or confirmed case of COVID-19 requiring healthcare facility admission and no aerosol generating procedure, we should include the hand hygiene, the gown, the medical mask, the goggle or face shield, and gloves. In case of suspected or confirmed case of COVID-19 requiring healthcare facility admission with aerosol generating procedure, we should include the hand hygiene, the gown, the respirator or N95 mask, the goggle or face shield, and gloves. To counteract the potential decline in healthcare worker availability due to fear and anxiety, and to limit the potential rise of nosocomial infection, it is critical to strengthen healthcare worker safety and trust in the system within which they work. To this end, implementing what is called the Traffic Control Bundling or TCB, which is a tool that proved effective in dramatically reducing infection rates among healthcare workers during the SARS outbreak. In the traffic control bundling, when first arriving, all patients undergo triage outside the hospital. Those diagnosed with coronavirus disease are directed to an isolation ward where they are placed in separate rooms, which is called the hot zone or the red zone. Those exhibiting atypical symptoms or awaiting confirmed diagnosis are directed to a quarantine ward for the maximum incubation period, which is called the intermediate zone or the yellow zone. In both cases, patients follow a designated route to the relevant ward that avoids the clean zone or the green zone. Hospital staff transitioning through the zones utilize 75% alcohol dispensers for gloves on hand sanitation at checkpoints positioned between each zone. Hospital staff don personal protective equipment or the PPE and as needed additional equipment such as the eye protection and respirators before entering the intermediate or the hot zone. When exiting the intermediate or hot zone, hospital staff undergo decontamination and removing the PPE in the transition zone. Throughout the decontamination process, hospital staff disinfect their hands, whether gloved or not, to avoid accidental contact by skin or mucosa with the virus. To adjust for the asymptomatic nature of some cases, all visitors to the hospital must don masks and use 75% alcohol hand sanitizer prior to entry. This is a conceptual scheme for the traffic control bundling. As you can see, the hospital is classified into three zones: the hot zone or the isolation ward for COVID or proved COVID patients, the intermediate zone or the yellow zone, which is called the quarantine ward for patients with waiting for the confirmation of the diagnosis or with atypical symptoms, and the green zone for other non-COVID patients. The outdoor triage station will classify the patients with positive diagnosis to be isolated in the red zone, or pending diagnosis to be transferred to the quarantine or the yellow zone. The other non-COVID patients will be transferred to the green zone. When healthcare workers leave the green zone to either the yellow or red zone, they must put on their PPEs, which is called the donning. On leaving the red or the yellow zones, they should remove their PPEs, which is called the doffing. Decontamination, hand disinfection throughout every single step of degowning or the doffing. As we see, there are yellow arrows that draw the route for moving from one zone to the other in order not to form a common pathway for COVID and non-COVID patients. In the case of a patient with COVID-19, the patient should be put in a single room or in a room that contains only other patients with the same diagnosis or with similar risk factors, and ensure that every patient is separated by at least 1 meter. Also ensure that transportation of a patient to areas outside the designated room is kept to a minimum. This flow chart is very important to understand how the healthcare workers at Ain Shams University Hospital cycle to work in the designated hospitals for treating COVID-19. Any healthcare worker to be assigned to work in a designated hospital for treating COVID-19 will perform a PCR 1 day before entering the designated hospital. The PCR might be positive, so he will be treated as a confirmed case. If the PCR is negative, he will enter the designated hospital to work for 14 days. And at the end of his work, he will perform a PCR. The PCR, upon ending his work at the designated hospital, may be either negative, and this gives the healthcare worker a week holiday as a convalescence after his stressful work. If he, after this 1 week, is asymptomatic and feeling well, he returns to his work. But if during this week holiday he develops symptoms, he will repeat the PCR and will be treated as a probable case. If the PCR upon discharge from the designated hospital for the healthcare worker is positive, he will be either symptomatic and he will be treated as a confirmed case and will remain in the isolation until completing 10 days from the onset of symptoms, with last 3 days symptom free. If the PCR is positive but he is asymptomatic, he will complete the isolation for 10 days from the day PCR test was performed. And then after these 10 days, if he is still asymptomatic and feeling well, regardless of the PCR result, without repetition of the PCR, he will return to work. But after these 10 days, if he is substantially developing symptoms, he will be treated as a confirmed case. At the end of my lecture, I hope that it was fruitful and informative and helps anybody to, especially healthcare workers, to protect themselves during dealing or treating patients with COVID-19. I wish you all the health and all the safety, and take care of yourselves. There is no emergency during epidemics. Take care of yourselves. You are the frontliners. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.